Dr. Pigment, and as a dermatologist, I've always believed that one laser which is very essential to your practice is a Q-switch NDI laser. So today I'm going to introduce to you this Magnus laser, which is a new Q-switch NDI. We've been using it for some time now, and because in my practice there's a lot of rejuvenation and the laser toning that we do, so I find it very ideal. You can see the screen here of this. So, if I go back here and I show you, it has all the qualities which you need in a good Q-switch. And remember that you need a workhorse which can, like we have brides where we do full body Q-switch. So this laser comes very handy there. So as you can see on the screen, we have a Genesis mode, we have a STP mode and PDP mode. But I'm going to talk about the modes later, but what I like about this machine is that it gives me the option of Genesis mode. Now typically we know that Q-switch is a nanosecond, right? So these two modes we are working on 5 nanoseconds. At that nanosecond it will blast the melanocytes. So this is typically the modes which I could use when I am dealing with pigmentation, right? STP is a single pulse mode and PDP is a pulse in pulse. So if I am dealing with a stronger pigmentation or a fairer skin, I will use a PDP mode, else normally a STP mode. But what is special about Genesis is that there is, no technology as such which I get in microsecond where I actually can work on the collagen, right? As dermatologists, we keep talking about collagen rejuvenation. So here I get 300 microseconds of wavelength here, and we know by going back to selective photothermolysis that it is very important that the machine that you choose has the right parameters. Otherwise, as a dermatologist, this is my tool to deliver results to my patients. So you have to choose your tool well. So here I have a patient, since you are seeing here, she's got some acne scars, open pores, a bit of pigmentation. The right side of the face may appear a bit darker. We have just put a carbon emulsion there to do the carbon toning. So we are going to use STP mode here. Now this is the screen. Now let's first understand that what it is. So don't get confused if you are seeing it for the first time. Of course, the top is, it gives temperature. The room is air conditioned right now, of course, because we are kind of shooting this, so there are a lot of people. So the temperature has gone a little high. Please make sure that your rooms are at optimum AC because that will ensure the life of your machine. The next you see is the spot size. Now, ever since I started using Q-switch, I always wanted some machine which can give me a larger spot size. Because, the smaller you go, you can hit the melanocytes, you can get permanent hypopigmentation. So that is the risk which you run. So this machine, it gives me the option of this can go up to 10 millimeter. So for rejuvenation, it becomes very handy, especially if you're doing the whole body. Right? Now, in your control, you have the frequency and you have the fluence. These are the two parameters you govern once you have the machine. So frequency, if it can deliver high frequency, and again, to fasten your treatment better, it can give you a high frequency. So, the repetition which can go up to 10 here. So I'm going to go down to 5 here, and we are going to start rejuvenation here. Now, why did I apply the carbon? Is because this energy. Fine. Okay. So we have chosen the fluence to be 1.78 millijoules, and this is a very high-powered machine. It can deliver up to 1000 millijoules. So what are the indications that we can cater to with this machine? Well, this is my favorite machine because it caters to a lot of indications in my day-to-day practice. To start with, everybody is bothered about pigmentation. As Indians, we tend to pigment a lot. So it can be used safely. There is no downtime on face. It can be used on body parts. For brides, we use it on the whole body. Second is you can even deal with epidermal pigmentation like melasma or freckles. Then deep dermal birthmarks and pigmentation like nevus of Ota, Hori's nevus, or even a dermal melasma. Of course, melasma management is totally different, but a Q-switch has a very important role to play in the management of melasma. And what is good about this machine is that there are hardly any consumables in this machine. So that's why, as young dermatologists, if you're starting your practice, I've always believed that laser hair removal to be number 1 and Q-switch NDI to be the number 2 machine which you need to have in your practice. And again, remember that in Q switch, it is something which will take your practice, cosmetic practice, to the next level from day one. Because what does a patient want? A patient wants a face which is free from hair, free from blemishes, the open pores are reduced, and that is exactly what you are seeing here on the screen. That this is what this laser can deliver. Use it wisely, know your parameters well, know your skin well, and in our practice in QPs, we don't just use the machine, we prepare the skin before this, and after that we use the machine, and then we also use the serum in the mask. Because it's very important that the patient is educated properly, what are the do's and the don'ts, and a proper post